There are two different types of diagnostic tests available for the virus that causes COVID-19, SARS-CoV-2. The first is a molecular test. That is a real-time PCR test that looks for whether or not you are actively infected. So a positive molecular test is going to indicate that you are infected with coronavirus or that you have at least the presence of viral RNA in your system. The second type of test is a serology test. That collects blood to determine whether or not you have antibodies in your system. Antibodies would indicate that you have had exposure to a pathogen. So a positive antibody test indicates that you have had exposure to COVID-19 and that your body has developed antibodies against SARS-CoV-2. Testing allows us to capture two big data points. The first is ongoing infections. So using molecular tests, we're able to capture individuals in the community who are currently infected and are currently shedding virus. Serological tests indicate a historical burden of disease. So what is the number of people in the community who have already been exposed to the virus and who have developed an immune response? Why is this important? Well, first off, for a molecular level test to indicate active infections, we get a snapshot of existing caseloads. We're able then to treat those patients either at hospital or at home and prevent them from continued exposure in the community. In addition, from an epidemiological standpoint, it's very important to then look at contact tracing. That is, identifying individuals that patient was exposed to or interacted with days leading up to the positive test or days leading up to symptoms of infection, and test those individuals through the molecular test to determine whether or not they too have become infected. If they have, we can then treat them and isolate, preventing additional transmission. If they don't test positive, they have been at risk of infection and should then self-quarantine at home or think about social distancing in order to prevent additional community-level transmission. Serological tests are important because it gives us an overall picture of the community burden of disease or the prevalence of a disease in a community. So we're able to identify at the community level how many individuals have already been exposed, and that helps us determine who might be at risk for infection and what communities and or what states have a low level of existing antibodies to this virus. You can get an antibody test if you think that you have been exposed. First off, if you tested positive through molecular test, roughly about 4 weeks after testing positive, you can go get an antibody test. For those who are not able to get molecular tests done, roughly 3 to 4 weeks from either the day that you believe you were exposed or the day that you presented with some level of symptoms. Many states, their health departments have information on their websites about testing sites, both for appointment or by appointment, as well as those that are walk-in, and provide a number of resources and documents needed to go to each of these testing centers. There are a number of challenges that exist with the current serological tests. There are a number of tests on the market that have not been approved by the FDA. So it is very important that when you look at doing an antibody test, you do so through a medical clinic, a testing center, and with your healthcare provider's recommendations. It's also important to know that there is a chance of receiving what we call a false positive or a false negative on the antibody test. What that means is a false positive would indicate that you have antibodies to COVID-19 when you in fact do not. A false negative would indicate that the test results show that you do not have antibodies when in fact you do have a low level or some level of antibodies having been exposed. So there are, antibody tests are not perfect, but I think what is important to understand is that by being able to test everyone, either during an active infection through molecular tests or having been previously exposed or previously at risk through serological tests, we're able to really understand both our active caseloads as well as our community level exposure. And this will help us not only think about proper treatment protocols for our community, but also indicate the steps we need to reopen communities, schools, working environments, and have a safe and productive engagement at our community.